you can understand from its name that it is systemic, and it is characterized by autoantibodies which are mostly against nuclear antigens. So we call them anti-nuclear antibodies, or ANR. Okay, and we have different types of hypersensitivity reaction, mostly type 3 and also type 2. Type 3 was immune complex and type 2 was antibody mediated. Yeah, and talking about epidemiology, we should say that most of the patients are young women. Okay, it is seen in when a person is in the 20s or 30s, and it can be seen in children or old people, but mostly it is seen in young people, and mostly, especially in young people, it is prevalent in women. Okay, so the typical patient is a young woman. For SLE, we have some diagnostic criteria. Okay. In this table, you see some criteria. Some of them are clinical criteria, and some of them are immunology. And some criteria are related to the patient's symptoms, and some of them are laboratory data. Okay, and these are the clinical criteria for lupus. For establishing the diagnosis, you should have 4 of the clinical and immunology criteria, including at least 1 clinical and 1 immunology. Okay? What are the clinical criteria? For lupus, you have some symptoms related to skin. Okay? You have some, skin signs, for example, acute cutaneous lupus, which is in the form of a malar rash. I will see the picture later. You have discoid lupus erythematosus, or you have chronic cutaneous lupus. Okay, so you may have acute cutaneous lupus, which is in the form of a malar rash, a butterfly rash in these areas. It is like a butterfly. Okay, and you have photosensitivity, which means that by exposure to sunlight, the rash exacerbates. Okay, and you may also have signs of chronic cutaneous lupus, which is an erythematous plug, which is present again mostly on the face, and it may have a scale, it may have follicular plugging, and you will have it in dermatology. And sometimes you have alopecia. What do I mean by alopecia? Hair loss. Yes, you may have hair loss. And sometimes you may have ulcers in mucosa, for example, oral ulcers or nasal ulcers. Okay? And these are the mucocutaneous symptoms of lupus. Each of them is a separate criteria for diagnosis of lupus. You may also have joint disease. You may have serositis, inflammation of, for example, pleura or pericardium. And you may have renal disorder, which is a very important criteria in diagnosis of lupus. And you may have also neurologic disorders. For example, you may have you may see seizures, or for example, myelitis, neuropathy, or even psychosis. Okay, in lupus, and these are all caused by the immune reaction. Okay, and in lab data of the patient, you may see anemia, leukopenia, mostly lymphopenia, and you may also see thrombocytopenia. Okay, so you have symptoms related to skin, mucosa, and joints, serosal surfaces, and kidneys, central nervous system, peripheral nervous system, and also, in blood tests, in CBC, complete blood count, you may see reduced number of leukocytes, or you also may see anemia and thrombocytopenia. About immunology criteria is something about antibodies mostly. Okay, you may have different types of antibodies in lupus. The most important one is anti-nuclear antibody, okay, which is sensitive in diagnosis of lupus, but it is not specific. I mean that you can see presence of anti-nuclear antibodies in different types of autoimmune disorders. Two other types of antibodies which are more specific are anti-double strand DNA and anti-Smith antibody.
Smith?
Okay? Smith, yeah. So, which antibodies are present in lupus?
Three types. A,
Yes.
double-stranded DNA,
Yes.
and SM.
Yes, Smith or SM. Okay? So, anti-nuclear antibodies are sensitive, sensitive but not that specific, but anti-Smith or SM or anti-double strand DNA are more specific. You may also see antiphospholipid antibody, which you know what antiphospholipid antibodies are. Yes, you had it in hemodynamic section. Yes?
Which one was not specific?
I know it's not that specific.
Ah, nice.
Because you see positive INO in many autoimmune disorders. Okay? Antiphospholipid antibodies are also seen in lupus. Okay? And because of presence of immune reaction and activation of complement system, we have reduction in the level of complement factors. For example, C3 or C4, CH50, okay? Because they are, because of consumption of complement factors, okay? And also because of presence of antibodies, we have positive direct Coombs test, okay? So, these are the immunology criteria. What are the immunology criteria? Somebody tells me. Which antibodies?
Anti-double stranded DNA,
Yes.
SM, and also no protein, no complement protein.
Factors.
And also we have a positive test called DREST.
Direct Coombs test. Direct Coombs test, and we also have some antiphospholipid antibodies. Yes. So these are the criteria.
Is it necessary to memorize all?
No, you should be just familiar with the criteria and the things that we have in the next slides. But it is not necessary to memorize them. But the symptoms of lupus are important. But because this is pathology section, mostly the pathogenesis is important. But I suggest to you that you learn lupus now, because you will have it in rheumatology, internal medicine. Yes. Okay.
So we have to memorize the groups of anti-nuclear antibody, like a histone antibody, DNA antibody, nuclear antibody, and non-histone antibody.
Here in lupus, you only have to know that we have anti-nuclear antibodies, and that we have, for example, anti-double strand and anti-Smith in lupus, and that we have anti-histone in some special types of lupus.
Okay.
Okay. So, how do we detect the presence of anti-nuclear antibodies? Yes, some special tests. We have different types of tests, yes. Sometimes we examine the patient's serum and look for the presence of antibody by tests such as ELISA and the things that we have learned in immunology. But sometimes, especially in lupus, we have other types of tests. For example, we have indirect immunofluorescence tests. Okay, we have the antigen in the lab. Okay, and we have the patient's serum. Okay, if the patient has lupus, he or she has antinuclear antibody in his or her serum. Okay, and we use a secondary antibody which is conjugated by a fluorescent material. Okay, so if the patient has the antibody, the secondary antibody attaches to this antibody, and by examining the specimen by fluorescence microscopy, we see the fluorescence, yeah? You have the
You
fluorescence.
can find that there's anti-glucose. There's ANA.
Different types of antinuclear antibodies by examining the pattern of positivity, okay? For example, here we have homogeneous pattern of positivity, okay? Here you see the nucleus, yes? We have diffuse fluorescence, yes? We call it homogeneous or diffuse staining pattern, okay? It means that we have antibodies against chromatin, histones, or double-stranded DNA, okay? Here we have the ring pattern, okay? Ring pattern of positivity. It means we have antibodies or to double-stranded DNA or nuclear envelope proteins, okay? And for example, here we have centromeric pattern, or we have speckle pattern. You do not have to memorize the patterns, but you should only be familiar with how indirect immunofluorescence test works and how do we diagnose the presence of different types of antinuclear antibodies in different autoimmune disorders. Okay?
So you don't need to memorize the details.
No, but for yourself, you study them. But there won't be any questions in the exam. Okay? Or sometimes you see nucleolar pattern. Okay? And I told you that we have other types of antibodies in lupus. For example, antiphospholipid antibodies. Do you remember antiphospholipid syndrome? You had it in hemodynamic. Section 3.
For hemodynamic, we only have two stations.
Okay, it's not.
You
You know, okay. You know, we have sometimes we have primary antiphospholipid syndrome. Sometimes it is secondary and it is associated with lupus. In antiphospholipid antibodies, we have some antibodies that cause, coagulation. Okay? So these patients have recurrent thrombosis. Okay? For example, the antibodies are, for example, lupus anticoagulant antibody, anticardiolipin antibody, or sometimes there are some antibodies that cause false positive test for syphilis. Okay? So, antiphospholipid antibodies are present in some patients of lupus in 30 to 40% of patients. Okay?
But these three in the bottom, they don't include the lupus. False, for example, false positive.
Yes, you know
That's
when
the
we
reason
have
why
yes when we have antiphospholipid syndrome, we have false positive syphilis test, okay, or you may have other types of antibodies, anticardiolipin, lupus anticoagulant, and things like this, okay.
So, thrombosis.
Okay.
This one
And
against the beta 2 glycoprotein.
yes, yes. And you know, in pathogenesis of lupus, like other autoimmune disorders, we have some genetic factors. You know, you may see that in some families, for example, mom and daughter are, have lupus, or for example, two sisters have lupus, and there is some association with genetic factors, but it is not complete. Sometimes you do not see this, relationship between, for example, genes and lupus. Okay, and we have some environmental factors. One important environmental factor is UV light. Why is UV light a cause of lupus? You know, UV has some roles in making antigens which the body reacts against. For example, UV light induces apoptosis and alters DNA and makes it immunogenic. Okay, so by alteration of antigens, it makes them immunogenic for the body. Okay. And sometimes UV light modulates the immune response. And for example, it stimulates keratinocytes to produce interleukin-1, which causes inflammation. Okay? So, what does UV light do? Mason is laughing.
It activates some, what was it called? Antigen?
It alters the antigens and makes them immunogenic for the body, and also it causes the keratinocytes to produce interleukin-1, which causes inflammation. Okay, so UV light is so important in pathogenesis of lupus, and we also have gender bias. It is more common in women, and we also have some medications that cause SLE-like symptoms. For example, hydralazine, procainamide, and penicillamine. Okay, so these are the environmental factors. Okay,
And this is just to stop the thrombosis.
sorry.
It's just to stop the thrombosis. The drug penicillin.
Yes, penicillamine.
Is
Penicillamine.
it related to beta-lactam drugs?
No, penicillin is different. Penicillamine.
Penicillin?
No, this is penicillamine. That is penicillin.
Penicillamine stop the thrombosis.
I don't understand what
The penicillamine stop the thrombosis, coagulation cascade.
No,
So how does it work?
but the drug-related lupus. No, it is because it causes production of antibodies, autoantibodies, anti-histone antibodies.
So it causes autoimmune disease at the same time.
Yes.
I get it.
It's not related to microbial disease?
This is. Why do you think it's related to microbial disease?
Because it has similar name as beta-lactam.
No, penicillamine is different from penicillin. It's the penicillamine, and it is not related to infection. You know, there are some medications, for example, some of them are antiarrhythmic ones and some of them are not, and they cause symptoms related to SLE. Okay? And We also have some immunologic factors, for example, failure of self-tolerance in B cells, or for example, in T cells and in cytokines that will give rise to SLE symptoms. And here you see the pathogenesis of lupus. As I told you, we have some susceptibility genes, and we have some external triggers, for example, UV radiation, and we have production of autoantibodies, and after that we have different symptoms of lupus. And I told you that we have production of autoantibodies, okay? So we may have which types of hypersensitivity?
Two or three.
Yes. Most of the times we have type 3, but sometimes we may have type 2. And in type 3 we have activation of complement system. So we have reduced amount of complement factors in patients with lupus. And the symptoms of lupus are related to the position of immune complexes in different parts of the body. For example, one of the most important parts is kidney, blood vessels important, kidney important. Yeah? So we have, glomerulonephritis, vasculitis, or for example, serositis, arthritis. Yeah, we have, inflammation in different parts of the body because of the position of immune complexes. Yes.
Why majority of the diseases are related to liver damage?
Liver damage.
Yes.
Because most of the times when you have immune complexes, they are deposited in places which are related to do something with the filtration of a fluid, for example, kidney, joints, or for example in vessels, because the immune complexes are formed in the vessels, and that's why most of the times they involve these organs. But sometimes you may see symptoms related to other organs in diseases related to immune complexes. Not always in these organs, but they mostly cause symptoms in these organs.
And if I got glomerulonephritis, I have to suspect there's also bladder inflammation.
Sorry?
If patient got glomerulonephritis, the patient should also have bladder inflammation?
Yeah, sometimes. Yes, sometimes. When you see that the patient has glomerulonephritis, there are different causes, okay? By examining the biopsy sample, you should, find out which cause, is present.
So penicillin will help out or not?
Sorry?
Penicillin will help out or not?
Oh, maybe.
Okay.
Penicillin or
Penicillin.
Yes, oh, it depends. Because, penicillin is, helpful in microbial bacterial infections. First, you should find the cause, and then you should treat it.
Okay.
And for lupus, no. For lupus, you should, test cortisons or, some medications that decrease the immune response. Okay? So, we may also see type 2 hypersensitivity in lupus. We don't have much time and we have a lot to say. And as I told you, we have also antiphospholipid antibody syndrome in some patients with lupus, which is called secondary antiphospholipid antibody syndrome. And in antiphospholipid antibody syndrome, we have thrombosis in different organs, in veins and arteries, and most of the times we have ischemia due to that thrombosis, which causes, for example, cerebral ischemia, ocular ischemia, or sometimes because of that thrombosis, we may have recurrent miscarriages in women. Okay? And as I told you, we may have neuropsychiatric manifestations, for example, psychosis, yes, myelitis, and that is because of presence of antibodies that cross the blood-brain barrier and they react with, for example, antigens and neurons or the receptors for neurotransmitters. So, about morphology. In blood vessels, in lupus, we have which type of necrosis?
Fibrinoid.
Fibrinoid necrosis. What do you see in this picture? You have deposition of this homogeneous material in the wall of blood vessel, as you see here. This is fibrinoid necrosis.
Well, the cursor doesn't show. So this is vasculitis.
Yes. This is vasculitis, which is seen in lupus.
And what's in the center?
This is the lumen of the vessel.
And
The
this
lumen
is giant
which is-
cell. The amount is
No. This is the lumen which is filled with RBCs, okay?
okay.
And this is the vessel wall.
This is the vessel wall.
Yeah.
And how do you know it's nephritis?
Sorry?
How did you know it's vasculitis?
Because of the presence of, this fibrinoid necrosis is
Because
diagnostic for vasculitis.
so this extra circle shouldn't be there.
This what?
Extra circle.
Which circle? This circle?
Yeah.
No. No, because this is inflammation surrounding the vessel.
Okay.
And in kidney again you have different classes of kidney involvement in lupus. We have minimal mesangial lupus nephritis, mesangial proliferative lupus nephritis, focal lupus nephritis, diffuse lupus nephritis, membranous lupus nephritis, and advanced sclerosing lupus nephritis. Sorry, let me hold
Also like
photo.